Hello, today I am going to tell you how fat absorption occurs. So, it is the most common malabsorbed nutrient in the body. So, fat it gets absorbed in three phases. Intraluminal phase number 1. Number 2 is mucosal phase. Number 3 is lymphocytic phase or lymphatic phase. So, in intraluminal phase, fat in the form of triglyceride enters the body, and then we give oral fat, and then it undergo lipolysis. Lipase comes from pancreas. It is an enzyme, and then triglyceride converts to free fatty acid and monoacylglycerol. This monoacylglycerol can't enter the mucosal phase. Why? Because there are many microvilli present here. So it needs a carrier. So what will happen? Liver, it will send bile to here. Now this whole thing will become micellar formation. Micellar formation, it enters the mucosal phase and then again gets converted to free fatty acid plus monoacylglycerol. This monoacylglycerol and free fatty acid, there's no use of monoacylglycerol now. This free fatty acid then binds with beta lipoprotein, sorry for my handwriting, and then it forms chylomicron. Chylomicron then gets transferred into the lymphatic phase. This whole thing is the fat absorption. Now, malabsorption. How does malabsorption happens? So, in intraluminal phase, it can happen when there is decreased lipase secretion. So, lipolysis doesn't happen. This is a cause of chronic pancreatitis. Then there is decreased pH. Decreased pH causes inactivation of this lipase. So this is also a cause, like in gastrinoma. Then the bile thing. This bile is a very important key factor. So bile, if there is decreased bile synthesis from the liver, like in liver cirrhosis, this carrier will not happen. If there is decreased bile excretion, it is not coming only, then example, that is bile obstruction, bile duct obstruction. And then there are chances that there is bile deconjugation. It is not getting conjugated. If it is not getting conjugated, then it will not happen. This bile deconjugation is due to bacteria. Bacteria doesn't make bile deconjugation. So this is a cause. Example, bacterial overgrowth syndrome. There are also cause, if this microvilli, this is absent, then also this will not move from intraluminal to mucosal phase. So celiac sprue, if proximal small intestine, in proximal small intestine the absorption happen, in tropical sprue in distal small intestine the absorption happens. Then this beta lipoprotein, if beta lipoprotein is not present, sorry for my handwriting, then this chylomicron will not be formed and it will not go into the lymphatic phase. So beta lipoprotein, so A beta lipoproteinemia. And also in lymphatic phase there are causes like cancer, filariasis, and congenital diseases. Also, When you see there is fat soluble vitamin deficiency, it means the fat is malabsorbed. What are vitamin A deficiency? Means immune deficiency will be the clinical manifestation. If vitamin D deficiency, means multiple myeloma is the cause. Then vitamin E deficiency, it means it could be skeletal muscle atrophy, retinopathy, and spinocerebellar ataxia. Then vitamin K deficiency, bleeding disorders can be seen. That is ecchymosis is seen. So this whole thing is fat malabsorption. Hope you like this video. Thank you.